everyone. Welcome to this edition of Senior Care Spotlight. I'm Nancy Fenimore, and I'm the publisher of the Seniors Blue Book here in Colorado. And today I have the very distinct pleasure of welcoming Kirsten Tedla. Now, Kirsten, you are the Director of Business Development for the awesome Denver Hospice. And I want to start off actually by mentioning I have a personal connection to the Denver Hospice. I never mentioned to you, Kirsten, that I had a family member a few years ago that was in your inpatient care center in Denver. So on behalf of my family, on the way you guys took care of that situation and of her, I want to thank you. But anyway, I digress. I wanted to first just welcome you. Thank you for joining me, Kirsten.
Thank you for having me.
Of course. How are you doing today?
I'm doing great. It's nice and chilly. It's starting to feel like fall. So
I know, right? Trying to open that new wardrobe.
Yes.
Great. Well, again, so you are with the Denver Hospice. The Denver Hospice, by the way, for our viewership here, is one of the largest non-for-profit providers of life-enhancing hospice and palliative services here. Thank you again for coming. I want to just open it up to you, if you wouldn't mind starting us off and telling us a little bit about, really your role there, and also just tell us a little bit about the Denver Hospice.
Yeah, so I'm Kirsten Tedla. I'm the Director of Business Development for the Denver Hospice, and then our palliative care side is called Optio Health Services. I've been with the Denver Hospice for over 2 years now, and have just really enjoyed serving the community in Denver and Boulder area as well, and have been in healthcare for like 16 years, ever since I was 16. So do the math. No, I'm just kidding. And so I feel really thankful to be serving in the end of life space. A little bit about the Denver Hospice. We have been serving the community for over 40 years. And like you mentioned, Nancy, we are the largest non-for-profit in the area. We've recently just opened up or expanded our pediatric program as well. So definitely a difficult space to serve in, but very thankful to be serving those patients and families as well when they need it.
Right.
So definitely thankful for that. We are very thankful to have our inpatient care center, which sets us apart in the Lowry area. And as you mentioned, have had many community members that we've been able to serve in that space, and just provide that level of comfort for patients should they need it. Should the home not work out, or be too much for a patient. So very fortunate for that. Our palliative care team is amazing and serves many cancer patients, working to fight that disease and support them in the home environment and try to keep them out of the hospital with COVID and everything as a concern right now, just doing our best to enhance the lives in the home setting. So
that's awesome. I have a question or actually just a notation I wanted to mention, and if you could comment on it, I'd appreciate it. And that is that a lot of folks aren't aware that hospice services exclusively are covered under Medicare. So, a lot of people ask, how am I going to pay for this? So can you touch on that just a moment, please?
Yeah, so we are really fortunate. Our quality scores, which means the ratings that our own patients have given us after they've had care, are very high. And so we're able to partner with many insurance companies, and almost 90% of the time with insurances, the hospice benefit is covered at 100%. And then specifically under Medicare and Medicaid, it's for sure covered at 100%. So it's a great benefit at end of life for patients to utilize, and it's free. We bring everything to you: the medication, the supplies, the care. It all comes to you wherever you call home. And so very fortunate that service is covered, and it's the last thing you need to worry about when you're facing that time of life.
So true. Is that the same for palliative services as well?
Palliative works a little bit differently. It works as a copay. So if it's the same amount, if you were to go see your primary care physician, it's the same amount that you would pay as a copay. So if that's typically $20, it would cost $20 for our nurse practitioner to come to your house. So it works a little bit differently. And then the additional services under palliative, from the social worker and chaplain that we provide, or spiritual care, that is not a charge. It's just that copay for the nurse practitioner.
Okay, great. Now, can you also tell us a little bit about the areas that you do cover,
Yeah.
geographically speaking?
So we cover down in Castle Rock area and east and west of Castle Rock, and then go up through the Denver metro area up north, up as far as like Longmont area, Boulder, and spread out east and west from there too. We also serve the Brighton community, and everywhere in between. We go a little further east than we do west. And so, yeah, we have a great coverage area and can support a lot of families.
Well, as you mentioned, you started in the 70s and your main Denver office over in the Lowry area, obviously that's where your admin offices are, where you, have handled all the metro business. But recently you guys opened a north location, I think in Westminster, right?
Yeah, we were so fortunate. Last year, we were able to move our administrative buildings right next to our inpatient care center in Lowry. So we had that big move. And then at the same time, we were able to open up an office in Westminster, which has just been a blessing for the community, especially around the bereavement space.
Yeah.
We've had a number of families that it's more difficult to get counseling down in the Lowry area. So just so neat to have a counseling office. And our counselors are coming up here as well to provide that bereavement support. And then also just for our patients and families, we have supplies and medications up here. And so it's a lot easier for our folks to have access to getting their supplies and anything that they need to serve our patients quicker and easier. So it's been a great blessing, and just so thankful to have the space.
I also know that now COVID has kind of thrown a wrench in a lot of things, including what I'm about to ask you about, and that is your grief support. You have classes, you have all kinds of things that, and like I say, pre-COVID is maybe a little bit different than where we're at right now, but can you touch a little bit on some of the support that you offer families as well?
Yeah. Definitely. It was difficult during COVID. A lot of things went virtual for our bereavement support groups that we have. Because we're in our new administrative buildings and we're able to spread out and provide that space to the community and have conference rooms that are sizable to hold families and be safe. We have opened back up our support groups. So there's a number of them running right now. I just saw one this morning as I was walking in the building. So just such a neat space for people to grieve in a supportive environment where they can talk about similar experiences that they've had and with their loved ones and just process in that setting. So we're very fortunate to have a great bereavement program that's able to offer those support groups. So they are up and running, and they send, if you're part of our network and have your email on file with us, you'd get updates and be able to join that as well.
Well, I probably am preaching the choir here. I don't have to tell you this, but hospice care providers are pretty special people. They do something that until and unless you have to walk in those shoes of navigating and being with a loved one through the death and dying process, you just can't even imagine how wonderful they are. So you have a great staff there, I know, and a longstanding staff. So I just wanted to thank you too. And if you have anything to comment on that, please feel free.
Yeah, I think working in healthcare right now is so interesting, and having the ability to adapt and to figure out how to continue to serve patients despite the nationwide nursing shortage and certified nursing assistant shortage. It's just amazing to continue to see our teams out there taking on patients and providing support and continuing to work through this. And also, healthcare workers have their own issues too. We're all facing these really hard times. So it's just amazing that we're able to keep coming to work and keep giving to our patients. So I second that. Such a huge thank you to not only in the hospice and palliative care space, but just all over, and in pediatrics and in the hospitals and in the clinics. These settings have all been devastated in their own ways, and they keep continuing to show up and serve patients. And it's just amazing to see the people that are still in it, and just a huge thank you to all of you. So
I'm going to put a slide up here with your contact information. So if folks want to reach out to you, I encourage you to do so. The Denver Hospice is an amazing, amazing group. Thank you again for being with us.
Thank you
and
for having us.
have a wonderful day. Take care.
You
Thanks for
too.
joining us,
Take
everybody.
care.
Take
All
care.
right, talk to you
Bye,
soon.
all.
Bye.